Welcome back to the CIVDIV. Let's talk about asthma. Let's get into it.
Whiskey 9 Yankee 7 November Golf, over.
So asthma varies greatly among vets, from intermittent attacks to consistent symptoms. Key signs include shortness of breath, wheezing, chest tightness, and disrupted sleep. Severity increases with more frequent symptoms, reliance on quick relief inhalers, and triggers like exercise, occupational hazards, and allergies. Remember, the severity and frequency of your symptoms directly influence your VA rating, which we will get into in a little bit more depth here shortly. As I mentioned, your VA rating for asthma hinges on your symptom severity. To qualify, you'll need obviously medical diagnosis, proof of the condition, and if it was caused or worsened by your service, and the evidence of persisting symptoms. So basically that means even if you were diagnosed in service, you have to have something showing that your symptoms persist after service. Obviously, this only applies if you're doing your claim after your service. So how does the VA look at rating your symptoms? Well, it really stems from two main tests and one other factor, which we'll get into a little bit later. The first test is the force expiratory value, often seen as FEV-1. FEV-1 is the amount of air you can exhale forcefully in 1 second. The VA compares this against what a normal person would be able to breathe out, and that is measured as a specific percentage. Next, they use the force vital capacity, which is normally shown as FCV. The VA compares the veteran's FEV1 results with their FCV results, which gives them a holistic picture of your lungs capacity or your capacity to take in or release oxygen. This ratio is then met to represent the proportion of a person's vital capacity that they are able to then expel. This is all taking place in the first second of your forceful exhale. Vital capacity is the maximum amount of air that a person can inhale or exhale from their lungs. So it really gives them a good understanding of what your abilities are as far as your lungs are concerned. Now, there are going to be some instances where the FEV-1 and the FVC tests are not performed. If this is the case, then asthma can be rated based on the kind of medications that is used to treat the condition. They can also balance this off of the number of, say, ER visits or doctor visits in reference to your asthma. In this case, the physician must clearly record a thorough history of asthma attacks. It's very important that they articulate exactly what's going on with each and every visit, either to the ER or to your primary care provider. And here is the rating for the lack of test and going towards severity and frequency. As you may realize, asthma does not operate in isolation. It's often connected to conditions like sleep apnea, GERD, depression, allergies, and more, creating a web of health issues. So depending on your symptoms, a lot of these can be connected to presumptives and cause or exacerbate your asthma. So we're talking about sinusitis, rhinitis, or any of those allergy-based conditions. And it does help that asthma is under the PACT Act as well. So as we are starting to really understand the PACT Act, we know that depending on your location and time of service, this could be a presumptive once you are diagnosed formally by a health provider. By now, you guys should already know it's coming, the big three. In-service evidence, then start with that current diagnosis, and then establish the service connection with the documentation or that Nexus letter. Remember, detailed records, a personal account of symptoms and severities is crucial to getting a lot of your claims approved, and asthma is no exception. One recommendation that we're starting to give to a lot of vets is ensure that you are doing a personal statement with every claim. No matter what, no matter how much evidence you have, always put a lay buddy statement or a personal statement of some sort within your claim. This will only paint a better picture for anyone who is reviewing your records and actually going to be rendering that rating. So just go ahead and fill out that personal statement and just apply it or provide it with your claim. It can only help you. Just to wrap it up, remember, thorough documentation and an honest portrayal of your symptoms are the key to successful claims and often lead to claims being approved, even if it takes a little bit of work. But with that, that is all I have for you as far as asthma is concerned. I am Jay with TheCivDiv. Stay informed, stay resilient, and I'll see you next time.